Okay, so just to finish off, we're just going to put, so we spent quite a bit of time with rolling resistance because we know that that's an area where often many people don't feel they have any official or formal skills. They might use many of the skills that they already have, but they haven't possibly ever seen it set out in a more formal way. But we're just going to put this together. So if that's around the pre-contemplation where you might come to some of the resistant situations, if they're more further around that cycle into the contemplation scene, well, we might be more looking at this situation here, where very much again we've got that motivational laminate of the pros and the cons of these different benefits of these behaviours. And you can see down the pros, they believe they're susceptible, they believe oral health is a problem, and they believe that making a change outweighs some of the disadvantages. And so, again, we're down on this sheet down here, we're still in the motivation phase, and we're still, you can see here, we're starting to see some of this more positive language of needing, wanting, this can't happen again. And so here we're starting to work our way further around. So the contemplation and moving round into the next stage. Am I carrying on? Fine. Okay. So we now move in from the laminate here, which might help you in those type of situations, more to working through to identify some of the barriers. If we're now coming round and people seeing it's important, then it's moving from the why it's important round to the how to start to make changes. And this is one of the sheets that's available. The idea is it comes in your waiting room, but you can use it in however format you use it. And you can start to see that parents or a guardian or somebody starts to identify what areas of conversation they want to concentrate on. And so already, rather than you almost making it up or you always talking about your favourite thing, which is about toothpaste or toothbrushing, you can see the parent starts to have some control and starting to inform what areas of conversation they want to talk about. So in your pack here, you can see that there is a resource kit where almost the parent's starting to identify it. But you can see now we're starting to work our way around into the how to do it. And it might be around toothbrushing and some of the brushing tips, or it might be around some of the other barriers such as healthy eating, or how to get a wider member of the family on board, or possibly how to brush children's teeth when they won't let me brush. Or another of the key findings was, how do I find time in my busy day to fit in toothbrushing? And you can see that there are resources for each of these, and if we just look at one of them, so this is just the healthy eating leaflet, which again is in here to help you. The important thing is this is not replacing the conversation. You still have the conversation, but this allows you to give some resources for a parent to take home for them to mull it over and have a think about afterwards. And you can see within the leaflet there are some examples of good and healthy foods, foods which are less healthy for your teeth, and a few other key messages. And so we're moving from that contemplationary phase into preparation, and we're starting to think about how I'm going to put this into practice. And at the back of each of the leaflets, you can see an action plan. And this allows the parent to trying to identify something they want to take on board. So that's not you trying to push or engage them. It's almost for them to identify what they want to work on, and you can write that down as part of that little tip. And obviously, for that action plan, it might be that you want to make sure that that action plan is SMART, as in, I'm sure we're all well aware what SMART stands for, but making sure those little action plans are easy to achieve and you can measure whether they're making that difference. And if that is the case, at the end of the consultation, then we're moving into the action, and they're going to have to put those actions into practice. And the important thing is that you're then going to catch up with them at a point which is convenient with you. That might be through an appointment. It might be a PDU session with one of your therapy team or one of your dental nurses, or it might be by the telephone and one of your receptionists phones up a few days or a few weeks later to see how they get through. But you can see that we're starting to move from action into maintenance, and if we're in the maintenance phase, then hopefully when you do get to see them, you can see that that behaviour has been taken on board. and we're ready to address the next challenge or behaviour in little small-sized bites at a time. But as we all know, and often on many situations, there's relapse or resistance, and we might have to work our way back round. And you can see here, has that behaviour been implemented? No. Well, let's have a think about where they are in that cycle. Do we have to drop all the way back to that pre-contemplation phase, or is it more around identifying another barrier and working through that situation? And that almost takes us all the way round the stages of change model. And so what we're thinking of is trying to relate where the parent is, the conversation you're having, with that stages of change. And hopefully what is a relatively complex model can be made very simple, and you're just simply thinking, well, how do I use the right resource in the right situation? So, that's enough of us talking. You've obviously listened to our team talk for the best part of an hour and a half, hour and 3/4. What we would like you to have a think about, and please share it with one of your colleagues if you want to, is what, having spent and given up all this time, how are you going to put this into practice? What is your action plan, having listened to some of this, on how you'd like to take this forwards? And so in your pack of leaflets, if you can find your action plan, make sure you put your name and initials on it, and then have a little write about what you think you're going to try and make all the stuff that you've heard, and how you're going to put that into practice.